to our video on how to protect yourself during the cold and flu season. My name is Dr. Bojana Jankovic.
And I'm Dr. Teresa Dean.
And today we're going to talk to you about 5 natural ways to protect yourself from cold and flu. So number 1 is vitamin C. And this is one of the questions that we get asked about a lot. How much vitamin C to take? Does it actually benefit me in preventing cold and flu? Does it reduce duration of my symptoms? So here's the data. There was a large Cochrane review done in 2013 that actually showed that vitamin C, although it didn't reduce the incidence of getting an upper respiratory infection, it did reduce duration of symptoms by 8% in adults and 14% in children, and it also reduced symptom severity. And this particularly applied to those with asthma. And the doses that they used were 1 to 5 grams of vitamin C per day.
Interesting.
Yes.
Another one that always hits the office is zinc. That's a hot topic.
Absolutely.
And while it also didn't reduce incidence or severity, it did reduce the duration of disease. So usually looking at doses between 75 and 80 milligrams per day, and it had to be started within 24 hours of the onset. And this was actually in a Cochrane review in 2013 as well.
Interesting. So you just got to start right away. To beat the symptoms. Another one that people may not be as familiar about for immune type of use is vitamin D. There's so much hype about vitamin D for various things, but vitamin D does influence our immune system as well. And so there were a few key studies. I'd like to mention a couple. One of them looked at 19,000 people, so a large study. They found that those who had vitamin D levels less than 10, so this is considered very low, they were at a higher likelihood of having an upper respiratory tract infection compared to those whose levels were greater than 30, which is considered to be normal. Interestingly, there was another study that then looked at school-age children specifically, and they supplemented these children with vitamin D, 1,200 international units daily of vitamin D3, which is in the ballpark of what we would normally recommend in our clinic. And they supplemented these kids during the cold and flu season. So this was December through March. They found that these kids were 40% less likely to get the flu if they were supplemented with vitamin D, which I thought was just fantastic.
That's amazing.
So it's not too early to start taking vitamin D. We're in December. You can do it. Yes.
Wonderful. So another one that comes into clinic as question is oil of oregano, which is a really interesting one. And looking at the data actually is mostly USDA and even poultry science that looks at how effective it is in treating GI bugs. But the data actually is not very conclusive and in fact shows not much change for URIs like the cold and flu. Another interesting thing to note about it is if you are going to choose to take it, it should not be used during pregnancy or breastfeeding because there is some signs that it could be possibly dangerous during those areas of life.
I see, yes. And then lastly, one that a lot of people already know about and talk about, echinacea. So what does echinacea do for you? Well, their studies do suggest that it can help prevent cold and flu symptoms by 10 to 20%. And one thing that we would recommend is definitely talk to your doctor before starting to use any supplements and figure out which is the best supplement for you. What dose do you actually need to be on? And another great resource that I often use is Consumer Labs. And they really have the breakdown of types of supplements, different brands, and then they may issue certain concerns about some of them or have their lists of which ones are safe to take. So I would definitely recommend referencing either your physician or a reliable website before you start taking anything.
Absolutely. And another reason we talk about this is really not just taking care of ourselves. This is great for our wellness. It makes us go through the winter much easier when we have less cold and flu days, but really looking at how we are responsibly using antibiotics. So, you know, the CDC in 2013 estimated that there were 23,000 antibiotic resistance related deaths, which is really a huge number. And it's just so important that we really speak to our physicians and, you know, really find a physician you trust and make sure you're listening to them for their advice on when things sound like a virus and when things sound like a bacterial illness, and take care of ourselves the best way we can to prevent all of it.
Absolutely, absolutely. And so to start with that, I think I'm going to have a tangerine to get a dose of vitamin C. Thank you so much for watching, and take care of yourselves.
Absolutely. Thank you.